Are there any new or upcoming diagnostic tools for adults and pediatric patients that can predict a relapse?
All right. I thought you were going to talk about diagnostic tools for MOGAD in the first place, which we are actively participating in a new diagnostic criteria format. But in terms of predicting relapses, at the individual person level, no, actually. We are not reliably able to do that. If you look at the group level, patients with optic neuritis are more likely to have relapses, for example, than patients with myelitis as their first presentation. Children under age 10 with acute disseminated encephalomyelitis, or ADEM, as their first presentation are less likely to relapse than some of the other presentations of MOGAD. But when you look at an individual person, their MOG titer isn't reliably predictive of relapses. If they develop one or two, it's typically a small number of new changes on their MRI in the first 3 months to 6 months after their first attack. That has a 20% positive predictive value for relapses. In other words, 80% of the time you'd be wrong. Probably like almost anything in medicine, the most reliable identifier of someone who's going to relapse is time and close clinical observation. But unfortunately, we don't have a biomarker, lab test, or MRI signature that currently predicts it.
In the grown-up world, I think that adults are a little bit more likely to relapse than children, just in general. But as Brenda was saying, there's no individual marker. I think there are a few triggers that have become obvious. First of all, withdrawal of steroids. So when people come down off of their steroids, I think that's a major risk for relapse. So that requires close observation. And I think any activation of the immune system through vaccines or infection, those are also possible triggers that heighten my awareness that maybe a relapse could be coming. And I would say that the MOG antibody levels, if they remain high, are also a little bit more predictive of a future relapse than someone who went from a high level to say, a very low level, where I would think that the risk of relapse is lower in that person. But as far as a biomarker that is predictive of a relapse, like a monthly blood test, for example, that could tell us when a relapse is going to happen in the next few weeks or so, we don't have something like that yet.
Can I make one quick comment? As we're ping-ponging adult to pediatrics, so I'll go back to pediatrics. One really important observation, Canada has a vaccine surveillance program that's quite rigorous that I've been part of for 30 years. And we actually have not linked vaccines specifically to any relapses. And I make that point very explicitly because children have a whole bunch of vaccines given, and it's a major question I get from parents all the time. Is it safe to vaccinate my child? We are facing, as a community, an under-vaccinated pediatric population right now, partly because of the pandemic and access, and also a lot of concern about vaccines. Therefore, the infections we vaccinate against are on the rise. And a patient who's on immune suppression, if they have relapsing MOGAD, who then gets chickenpox, could end up with chickenpox encephalitis. We are at risk of seeing polio again. There are other infections that we vaccinate against that our pediatric patients need to be protected against. So, and certainly COVID. So because we aren't linking a specific vaccine signature to a relapse risk in multiple sclerosis or MOGAD or aquaporin 4, I think my advice on vaccines is I never give a vaccine within 6 months of an attack, not because I actually think the vaccine is going to trigger anything, but that's when a second event is most likely. And if a vaccine happened to be given, those two things are going to look like they were related when they weren't. And then, of course, there needs to be strategies on when to vaccinate, depending which therapy you're on and the type of vaccines you can get. And that's not specific to MOGAD. That's related to just how to give vaccines if someone's on an immune suppressant. So that is just something I had to say, because in children, the bigger risk to their health is not being vaccinated, not the other way around.